Okay. Hi, it's your favorite NP mentor here. So today I'm going to be talking about how can you protect your license as a nurse. I'm a nurse and I am also a nurse practitioner, and I know how important it is to all of us that we want to keep our license because we work so hard to get it. So in this video, I'm going to give you 5 tips that'll help to reduce the risk of litigation and to prevent you from having to show up in court. So let's go. First thing is you're going to chart by exception. Now, what does this mean? You know, a lot of us get into this like chart happy mode where we want to say 8 a.m. patient awake, eating lunch. We want to say 8 a.m. patient awake, eating breakfast, 9 a.m. patient out of bed to chair, 10 a.m. and so on and so on. So let's say, for example, you forget to put something at 11 a.m. and then something happens at 12 p.m. Maybe the patient had a cardiac arrest, or maybe he had a respiratory arrest, whatever the situation was. And somehow this case ends up in court. The lawyer will look at your documentation and say, well, what happened at 11 a.m.? You put something for 8, you put something for 9. Is there something that you're trying to hide? Right? So this is one of the main reasons why it's so important to only chart by exception. If nothing happens, it's really nothing for you to document. You don't have to feel the need that you have to document something every single hour. You really honestly don't have to. So the least, the better. Okay, because sometimes you actually put yourself into a hole when you start documenting things that are really not that important. So the first thing on my list is to stick to that rule of charting by exception. Nothing happens, nothing to chart. Don't get into the habit of feeling like you need to chart. You don't. If nothing's happening with the patient, you just make sure you have your vitals and you've put everything else like eyes and nose, whatever else is necessary. That's really all you need. You honestly do not need to write something every hour. So if you are doing that, you need to stop. Okay. Number 2, you want to report those critical labs in a timely fashion. Now, if let's say, for example, a potassium comes back at 7, right? And you didn't notify the doctor until 2 hours after the lab called you with this result. Now, by the time the doctor found out that the potassium was 7 and then there was a hyperkalemic cocktail ordered, the patient goes into cardiac arrest and passes away. So you're liable because most hospitals have a time frame where you're supposed to document who gave you the lab, the time that person gave you the lab, and what orders did you receive as a result of this lab result, right? You have to pull or if maybe there was no order. You also have to make sure you document all of that, and usually that's within an hour. Now, if you've waited 2 hours, you haven't gotten any orders, you haven't notified the doctor, and something happens with the patient, you haven't followed hospital policy. So the hospital will not protect you. Now, this is the reason why they have policies and procedures, is because these things are at place to protect the hospital and yourself if something happens. Now, let's say if there's a system error where you followed hospital policy and there was still a bad outcome, that's on the hospital, right? But if there's a policy and procedure for doing certain things and you don't follow that protocol, then that will 100% fall on you, because now the hospital cannot protect you because you have not followed the guidelines which the hospital has put forth regarding taking care of, regarding critical lab, regarding making sure you notify the doctor in a timely fashion about critical lab values. So you always have to make sure you write down who told you from the lab, the name, the time that the lab spoke to you about this, the time you called the doctor and when you spoke to the doctor, and what orders, if any, are received. All of those things are important and must be documented in a timely fashion. Because remember, in nursing, if you didn't chart it, then it didn't happen. So always remember that, okay? And number 3, you gotta know that chain of command. I'm gonna go back to the potassium issue because this is important. So let's say you had a patient who was on an insulin drip and the potassium was 2.5. Now, you know to yourself, let's scratch all that, start over. Number 3, we're gonna talk about, okay, wait, losing my mind. Number 3, know the chain of command. I'm gonna go back to my potassium example. So let's say you have a patient that comes in DKA, diabetic ketoacidosis, right? And the order is to start insulin. You've already given the cocktail, you've done all that, and you notice that let me start over again, scratch that. Oh my God, I'm losing my mind. Okay, last time. Okay, number 3, know the chain of command. So let's say you have a patient that comes in DKA and the physician wants to start, or the clinician wants to start IV insulin. So the labs come back and the potassium is 2.5. Now you know to yourself that if the potassium is already low and you start insulin, just because insulin shifts potassium into the cell, you know that that patient will become more hypokalemic. So you question the doctor and you say, hey, you sure you want to start this insulin because the potassium is 2.5? And the doctor tells you, yeah, just go ahead and start it. We could always just replace the potassium as the drip is running. Now let's say now you do that, even though you kind of had a bad feeling about it. You do it anyway, and the patient arrests and passes away. Now, you'll be just as liable as that doctor because you knew that that potassium needed to at least be 3.3 usually before you start an insulin drip. Now, let's rewind. If you get an order, let's say for anything that you're uncomfortable with, you don't agree with it, you feel like it's going to do the patient harm, you feel uncomfortable or uneasy about it, there's always a chain of command. And this is what you have to understand. You can escalate an issue that you feel could be harmful to the patient, and it doesn't matter who gives you this order. Now, in this situation, you could always escalate to the charge nurse, who can escalate to the nursing supervisor, who can also escalate to her boss. Usually they have somebody in the hospital who's in charge of making sure that these issues are resolved, that the nursing supervisor can report to if need be. Now, let's say this order was given by a resident or a nurse practitioner or somebody who you know has a direct supervisor over them. You could always talk to the attending. You can always talk to the intensivist, especially in ICU. Usually there are intensivists. If not, you always follow the chain of command. Who can you report this to? Because at the end of the day, if this goes to court for whatever reason, you're going to be just as liable as the doctor who told you to put this order in. Because remember, we are legally responsible to make sure that we are not causing harm to the patient. So if we think that something might result in harm, and it doesn't matter who gave that order, and we carry out that order, we are equally responsible as the provider who gave us the order. So we're carrying out orders, nurses are carrying out orders. You just got to make sure that the order is safe. And if you have any questions or you're not sure, you can always call pharmacy and you can always talk to the charge nurse. and hopefully the charge nurse has enough experience to be able to help you and guide you in the right direction. But then there's always the nursing supervisor. And that's what the nursing supervisor is there for, is to help mitigate these problems. Okay, so don't forget the chain of command. Know who in your hospital you can talk to, or in your facility that you could always talk to if there happens to be an issue. And number 4 is be careful how you document. Please don't put in your charting that received patient in bed sleeping. Now let's say you put that the patient was sleeping in bed like around 4 a.m. 5 a.m. patient was found pulseless, right? Now the question is, when you saw that patient at 4 a.m., were they sleeping or were they deceased? Right? So you want to avoid using certain terminologies. Don't say receive patient in bed sleeping. Like, don't say that. You should say something along the terms of, if you want to mention that the patient is sleeping, this is what you can say. Receive patient in bed sleeping comfortably, respiratory rate 12, 14, noted equal chest rise bilaterally. These are things to indicate that you are certain that this patient was sleeping and not deceased. Okay, so when they're doing a discovery component of like a lawsuit, this is the stuff that they look into, because the lawyer's primary goal is to get money, and they want to throw somebody under the bus. Just don't let it be you. Okay, so even if at 4 a.m. you write that the patient, you saw equal chest rise, blah, 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 and then the patient was checked on at, let's say, 5 a.m. and didn't have a pulse, that's okay. Like, something happened in between. And sometimes some patients are not on the monitor. You do rounds every hour. So, that's okay. But just make sure you be careful what you're documenting. And you don't want to put that somebody was sleeping without actually documenting how did you know this person was sleeping. Equal bilateral chest rise, respiratory rate 14, things like that. Like, that tells me, like, okay, this person was sleeping because you were able to count their respirations. You saw their chest rise equally and bilaterally. So these are indications that, yes, this patient was sleeping and not deceased. That's super important. So be careful with the terminology that you use, because that can actually get you into a lot of trouble. And last but not least, do not change that documentation if something happens to that patient. Okay? Let me give you an example. Let's go back to this patient that we just spoke about, that you wrote 4 a.m. patient was resting comfortably, and then 5 a.m. you found the patient pulseless, right? Now let's say you try to go back and you say, oh my God, I didn't document this correctly. And then after the patient passes away, you go back to the chart and you put equal chest rise noted, blah, blah, blah. Now it looks like you are trying to cover something up. Okay? So you cannot do that. You can be fired, because it will look like you are trying to hide something. Now, we don't want to look like we're trying to hide something, because then the hospital will get us for that, right? They will definitely get us for that. So you have to make sure that you be very careful when you go back and start changing things, because then it's looking like you're trying to cover something up. And if the hospital feels like you're trying to cover something up, they're going to fire you. Okay? So all you can do at that point is to document when you found the patient, what happened, blah, blah, blah. And you document moving forward, not moving backward. And just so you know, especially if you have Epic captures everything. Once you sign in, they know it's you. They can backtrack every single thing you did in that chart from the time you punched in to the time you left. So don't think that you could get away with stuff. Epic captures every single thing that you do. So be very careful about that, okay? And don't go back and change your charting if you still want your job, okay? So Ali, this part of the video, I want you to put this part, what I'm about to say, after I did number 3. Sorry, I completely forgot. All right. So if you find so far that I'm providing value for you in this video and you really like, if so far in this video I'm providing you with value and you are liking my video so far, please hit that like button and make sure that you subscribe so that you could get more information from moi. Anyway, and now I'm going back, Ali, to the end of the video. So this would be the end. Anyway, thank you for watching. I hope you enjoyed my video. If you want, wait, scratch that. It's a hot mess. Oh my God. Yeah, no, I'm good. I'm gonna just say what I'm gonna say it all over again. I'm done here. So thank you for watching. Please make sure you subscribe if you didn't. And thank you for watching. Bye.